So next we're going to do the second one we are talking about will be cough. The causes of cough, yeah, it's so common. So what is the differential or the portal that you use for dealing with a case of cough? Let's start with Ian.
Okay, so for cough, I think you can go into a few big portals first. Firstly, you can think about infections. Secondly, meat allergies. Thirdly, you can think about aspiration. And then for under aspiration, you can also think about post-nasal drip, maybe.
We don't go there yet, huh? We just go to the main portal. So I always I'm training them to look at big doors first, and then when you after the first land, then you go to the next level. So let's go the big one first. Okay? So infection, allergies,
aspiration,
foreign body or aspiration. Okay, and then
we can have like special things like COPD, maybe.
COPD. Okay. And then
that can be a side effect or adverse effect of drugs.
Drugs. So put down drugs. Okay.
And after that, we can add cancer.
Cancers, which cancers, and then.
I think that's all for my list.
Okay. Any other main things that you need to put in? No, I think at the moment that's a pretty good list for third year to final year. Postgraduate, you will have slightly other weird things, but I think we will leave that out because, yeah, I don't want you to remember all the weird things like wax in the ear, which I think for pediatrician we had to learn. I have no idea. I've never seen a case. It is strange. I mean, yeah. So there are weird things that you don't really want to learn, because if you don't know other things and you know that only, you're in big trouble with the consultant. So learn the important big things. So okay, talk about Chu now. Go through the list again.
Infection, allergy, foreign body aspiration, then maybe COPD, and drugs and malignancy.
And malignancy. Okay, so of course in pediatrics the list will be like that, but in medicine or surgical wards, the cancer and the COPD will come up, and then asthma still there, infection, so it will shift the list around. So the cancer will come up a lot higher than in peds. Okay, good. So let's talk about infection, the causes of infections for cough. Okay, give me the list, Amy.
So starting from the smallest,
viruses like
COVID, and then also dengue.
Cough. Okay, cough, okay. Then COVID and this season flu, okay, and RSV. So okay, so but COVID you have to put right up front already, okay, and then.
So the second one should be bacteria.
Bacteria like TB, good. No, TB. Then put in another one, the pediatric ones, which are all on the vaccine list. The vaccine list. What is on the vaccine list for chest infections? Childhood vaccination. Streptococcal pneumonia, is it? Okay. Pneumococcal, you mean? Is it pneumococcal? Pneumococcal, and then strep, Yes, whooping cough. Okay, but Bordetella, and then okay. So you can in bacterial list for cough, you can go back into the vaccination list and go through all the things that we use against bacteria for peds, protecting them against the infection, chest infection. Okay, so bacteria, and then malaria in cough. Fungal will be like in HIV patient. What? Candida, so Candida, fungal, and then parasites, the microfilaria, and all the larva migrans group. Okay, good. All right. So these are the big list, which I make them to go through from virus and increasing in size. So you can use the same list for fever cases with a different list, okay, but still the same So fever, causes of fever in children. Give me a list of the infective agents involved. Hon,
Infective agents.
in fever.
Fever.
Mm.
So first of all, so we also start from a small to big, so viruses, so such as like dengue, and then maybe
COVID.
RSV, COVID,
Okay.
and then we go to bacteria. So there's a lot of bacteria.
Okay, good. And then
fungus,
mhm.
in like especially immunocompromised patients, and then you have protozoa that can cause such as malaria, and then lastly we have all the parasites, the worms.
So this list is very useful. So in any infection anywhere, including the one that when you do a biopsy and pus comes out, the list of infective agents, you still have to go through that using that list. Huh? Yeah, of course you drop the microfilaria and all the other things there, but you still go through that list all the time. Huh? Okay, good. So we talk about infection as a cause of cough. Then secondly, we talk about allergies, which usually we call asthma, and then aspiration we include from liquid to solid. Okay, liquid to solid. Huh? So liquid, you refer to postnasal drip, you're talking about GERD. Okay, and solid, you talk about children with foreign bodies. Yeah? Okay, and then drugs. Now give me one drug that causes cough.
ACE inhibitors.
ACE inhibitor, people with blood pressure. Yeah, okay. Yeah, and then cancers, yeah, cancers will be primary, secondary, primary or secondary, okay? Primary or secondary. Okay, so cough, I think that should be quite a good list already. Then of course you're going to talk other courses, but I think that's a bit far already. Huh? So basic medical student, 3rd year to 4th year, I think that's plenty. Okay? Anything else I missed? Okay, environment, I forgot, yeah? So in now I think you need to put in environment. So COPD is, I don't know where to class it, so you can put it by a standalone. Cystic fibrosis also is very hard, I don't know where to put it, so that one's very important in Western countries. But the other thing I want to put in is, environment, which is smoke and dust, and New Year cleaning your neighbors, spring cleaning all the rubbish. So dust. So that is actually another group. So starting from, if we say environment, then you start from smoke, cigarette smoke, and so on, and then bigger particles, and then aerosols. I don't know where smoke, aerosols, and then you go into particulate. Okay. So that's the whole list of differential diagnosis of cough. So you can ask history along that line.